So I'm going to demonstrate a brief range of motion assessment for the cervical spine. We're going to look at flexion, extension, lateral side bend, and rotation. So for flexion and the lateral flexion, we're going to be looking for about 45 degrees with a normal value. The extension is going to be closer to 60 and rotation closer to 70. So for the flexion and extension, we're going to use a point on the ear like the external auditory meatus or the earlobe as the axis. Our stationary arm is going to be perpendicular to the floor, and then our moving arm is going to be at the base of the nostrils here. So I'll go ahead and set that up. We'll have the goni at 90 degrees. Once you have that set, I don't have a table, so I'll just squat down a little bit. I'm going to go ahead for flexion, just ask you to take your chin to your chest. And then I'll measure that there. And then go back up to neutral. For extension, I'm going to ask you to just put your head back. So again, looking at the earlobe as the axis, perpendicular to the floor, and having this at the base of the nostrils here. You can return to neutral for that. For rotation, I'm going to try to be above the patient as much as I can. And then I'm going to have the axis just basically in the center of the head. The stationary arm is going to be a line that's connecting both acromion processes. And then the moving arm is going to follow straight through the nose. So then I'll ask you to go ahead and look to the right. And I'll measure there. You can return to neutral. I would also do that to the left side in a normal examination. And then last, if you can face the other way. So for side bending, the way. Again, I'm going to have the stationary arm perpendicular to the floor. The axis, we're going to go about C7. If you can flex your neck down. I'm going to feel for that vertebrae right there. Go and put your neck back up. So that's my axis. And then the moving arm is just going to go through the center of the posterior head. And I'm going to ask you to bring this ear to the shoulder. Measure there. And again, we would do that to both sides. For passive range of motion, as long as the patient is not having any pain or symptoms with this, I'm just going to feel for the end feels basically. So I'll again ask you to put your ear to your shoulder here and apply overpressure. All of these should have a firm end feel. We're seeing how far the patient can move there. And then for flexion, again, you can have the patient bring their chin to their chest. If they can get their chin all the way to the chest, you don't really need to apply the overpressure there. So then you can do extension, and then apply a little bit extra, and then put your head back to neutral, and look to your right, and then again, rotating the patient, seeing what infeel you have there. You can also check for passive range of motion if the patient lacks normal range of motion during active processes, to see if you get any more with the passive process, to see if it's something that's actually blocking the movement or if they're just having like a muscular weakness or imbalance there that would cause them not to be able to actively do the motion, but you can get the motion with the passive process. Okay, to manual muscle test cervical flexion, we're going to have the patient lay supine. I'll have the patient position the arms in the 90-90 position. First, I want you to try to tuck your chin to your chest and then bring your head up, chuck it in, and then elevate your head. Good. All right, and go ahead and release. I will stabilize on the chest. Go ahead and do that movement again, and then don't let me push you down. Good, and go and relax. So a grade 4 or 5 would be tested in this position. Grade 3 would be if he was able to get through that position but not hold any resistance. Grade 2 would be movement through a partial range of motion, and grade 1 would be a palpable contraction with no range of motion, and then it would be 0 if there was no contraction. Scoot down a little bit again. So the manual muscle test for cervical extension is similar to that of flexion. You'll have the patient lay prone this time. Have the arms out again. So first, I will ask you to go ahead and tilt your head back. Good, try to keep your chest flat and relax. This time, I will stabilize on the posterior aspect here. Go ahead and do that one more time, and resist. Good, and relax. And then the grading will be the same for extension as it was for flexion. Okay, so to manual muscle test the lateral side bend and rotation, you'll have the patient seated with the correct posture, and then you'll ask them to again tuck the right shoulder, or the right ear to the right shoulder. Good, come back up. Do that one more time, and then don't let me move you from that position. Good. Now I want you to look over your right shoulder. Okay, and return to the original position. Do that one more time, and then don't let me move you from that position. Good, alright. And then this will be graded as a traditional manual muscle test would, depending on whether or not they could get through the entire range of motion and how much resistance they could do. In this case, the patient is fine and would be graded as a 5. Okay, for a vital sign assessment, we are going to check blood pressure. You want to have the patient in a seated position, relaxed, make sure the legs aren't crossed or anything. Going to wrap the cuff around the left arm. First, you can palpate for the brachial artery. And the reason that you want to do that is that you want to line the arrow up with the brachial artery. So since this is the left arm, I line up this arrow here. And get the blood pressure cuff tight enough. And I can take this off so that I can see it easier if I'm not in a good position to read it. When I inflate the cuff, I'm going to go about to 140 or 150 depending on the patient. I know he's pretty healthy and should have a decent blood pressure, so I'll just go to about 130 or 140 so I know that I get high enough to occlude. And then the first sound that I hear will be the systolic pressure, and this, the absence of the sound will be the diastolic pressure. So those are the two things that I'm going to listen for during the assessment. And that time the patient's blood pressure at about 125/85. Okay, I'm going to demonstrate a dermatomal assessment for the upper extremities. We're going to look at C5 through T1. You might do a dermatomal assessment if the patient is showing any symptoms, if they're having numbness or paresthesia in the upper extremity, if you have any suspicion of there being a radiculopathy, some sort of injury to the nerve roots that I mentioned, C5 through T1. This is going to help us determine the location of that nerve root injury, should there be one. If I was doing a thorough examination, if I was looking at a very specific part of the body, then I could do a sharp dull process. What I would do is introduce the patient to a stimulus that was sharp and another that was dull, have them close their eyes, look away, and ask them to distinguish the sharp from dull. I would do it within the dermatome that I was concerned about, or the dermatomes, and then the surrounding dermatomes as well. For a gross assessment, I'm just going to ask the patient to feel left from right and make sure that everything feels equal on both sides. I'll go ahead and have you close your eyes still. And then we're going to look at C5. Does this feel equal on both sides? And then C6, moving down and into the thumb. Does that feel equal on both sides? C7, we're going to look at the middle fingers and the middle aspect of the palms here, especially the middle finger. Does that feel equal on both sides?
Yes.
Now for C8, we're going to move to the medial aspect of the hands, up slightly into the wrist. Does that feel equal on both sides?
Yeah.
And then T1, we're going to move up further onto the forearm and arms, and does that feel equal on both sides?
Yes.
Okay, so we're going to perform a myotomal assessment for the same reason as a dermatomal assessment. If we're suspecting that there may be a radiculopathy present, this is going to help us determine at what level that radiculopathy is present as far as which spinal nerve root is affected. So first we're going to do an assessment for C5. We're going to look at shoulder abduction. So what I'm going to ask you to do is just bring your right arm out like this. Hold it there, don't let me move up. Good, you can go and relax that. So normally I would want to do both sides to compare them, but I'm actually going to do some on this side and some on that side just for video and setup purposes. C6, we're going to look at elbow flexion and wrist extension. So I want you to go ahead and bring your elbow up, and then don't let me pull you. Okay. For wrist extension, I want you to set your forearm on the table. Go ahead and bring your wrist up, and then don't let me push you down. Go ahead and relax. Then for C7, we're going to look at elbow extension and wrist flexion. Go ahead and do your wrist flexion first since I'm over here. Yeah, just get a little bit closer so you can put your arm flat. Yeah. And then flex your wrist up. And don't let me pull you here. Good. And then for elbow extension, have your elbow in just a bit of a bent position again. And then don't let me push into you, so push against me. Good. For C8, we're going to look at APB. So we'll come over here for the thumb. And I want you to just kind of hold your thumb up like this. And then don't let me push that down. Good. And then for T1, we are going to look at finger abduction. So you'll have these three fingers together. I'm going to try to push this one towards these. Don't let me push it. Okay, and that's an upper extremity myotome assessment. Okay, we're going to go ahead and look at the lower extremity myotomes. So I want you to go ahead and march your leg up first. L2 is going to be hip flexion. Don't let me push you down. Good. L3 is going to be knee extension. Kick your leg out to my hand, please. Don't let me push you in. Good. Relax. L4 is going to be dorsiflexion. Bring your foot and toes up to the sky. Don't let me push you down. Good, relax. L5 is going to be a great toe extension, so bring your toes up for me. Don't let me push it down. S1, we're going to look at plantar flexion. So for this video, I can just show you would have the patient push into my hand. Don't let me push you up. Good, and if you could go ahead and stand up for me real quick. S1, you can also just go ahead and have the patient do a heel raise. You could do multiple on both sides. Okay. We can also do a dermatomal myotomal assessment for the lower extremity. Again, if the patient is having any symptoms consistent with a neurological pathology, so if they're having any numbness, tingling, paresthesia, weakness, inability to control movement in a dermatomal myotomal pattern, this will help us to determine exactly which nerve root that lesion could be at. So we're going to start with L2. L2 is going to be upper on the anterior thigh. So if you can move your hands to the sides for me. L2, I'm going to have you close your eyes. Does this feel equal on both sides?
Mm-hmm.
And then we're going to move down just a little bit further for L3. Does it feel equal there?
Mm-hmm.
L4 is going to start up and then wrap around across the knee, down even into the medial aspect of the foot. So I can look at it here. Does it feel equal here? And then equal as I go down.
Yes.
S5, we're going to look at the medial dorsal aspect of the feet. Does that feel equal there?
Yes.
And then S1, we're going to look at the lateral aspect